Hey everyone, welcome to the Nursing Code 101. I'm so glad you're here. Today, we're diving into a topic that every nursing student dreads but absolutely must master: increased intracranial pressure, or ICP. If you want to keep your patients safe and your NCLEX score high, you need to crack this code with me. So grab your study notes, because we're about to make this complex topic simple. Let's get started. What is ICP? Pathophysiology and causes. First off, let's break down the word. Let the name help you here. Increased intracranial pressure just means high pressure inside the skull. Think of your skull as a sealed, rigid container with three main components inside: your brain tissue, your blood, and your cerebrospinal fluid. The problem is, there's a fixed amount of space. When any of these components increase, the pressure inside goes up. This is the Monroe-Kelly doctrine, a key concept for understanding ICP. So, what causes this pressure to rise? Think of anything that can increase the volume inside that sealed container. This could be more blood, like from a brain bleed, stroke, or aneurysm. More fluid, from swelling, inflammation, or an infection like meningitis. Or even more tissue, such as a growing brain tumor. All of these things can eventually crush the most important part of the brainstem, which controls our breathing and heart rate. And that's what makes this so deadly. Key signs and symptoms. Now, let's talk about the signs and symptoms you'll see. The NCLEX loves to test on this because early detection saves lives. The earliest sign, and a definite need to know, is a change in the patient's level of consciousness. Think irritability, restlessness, or a change in their mental status. This is our first clue that there isn't enough oxygen getting to the brain. Next, you might see some moderate signs like a constant headache and, this is a big one, sudden vomiting without nausea. Yes, you heard that right. It's that kind of random, projectile vomiting that you must report to the provider immediately. As the pressure builds and the brainstem starts to get compressed, we see the late, deadly signs. The most critical is Cushing's triad. Remember the name Cushing triad to help you, because the brainstem is being crushed. This gives us three classic signs: a widening pulse pressure, where the systolic and diastolic numbers get further apart. A very low heart rate, or bradycardia. And a low respiratory rate, or decreased respirations. If you see these three things together, you know that the patient is in a very serious situation. Nursing interventions. So, what are our nursing interventions to manage this? I have a super simple mnemonic for you: ICPS. I stands for immobilize the head. We want the head to be in a neutral position, in line with the body. No bending or twisting, this is a no flex zone. C is for keeping CO2 low. Carbon dioxide can cause blood vessels in the brain to dilate, which increases swelling. We actually want to hyperventilate these patients a little bit to blow off that CO2 and reduce pressure. P is for positioning. We need to elevate the head of the bed to at least 30 to 35 degrees to promote drainage. And finally, S is for suctioning. We want to limit suctioning as much as possible, and when we do it, it should be for 10 seconds or less. Remember to always pre-oxygenate the patient before you suction. Pharmacology and conclusion. When it comes to meds, there's one you absolutely must know for the NCLEX: mannitol. This is an osmotic diuretic. Think man, it hurts, or man, my head hurts. It works by pulling all the fluid out of those swollen brain cells and into the bloodstream, which is then excreted. The key nursing intervention here is to watch for signs of fluid overload, like crackles in the lungs, because we're essentially dumping all that fluid into the circulatory system. Alright, that's our crash course on increased ICP. We covered the pathophysiology, key signs, and critical nursing interventions. If you found this helpful, be sure to hit that subscribe button and the bell icon so you never miss a new video designed to help you ace your exams. You got this, future nurse. Happy studying, and I'll see you in the next video.